evening, friends, and thanks so much for joining us tonight for News 19 at 7. I'm Andrea Mock. Helping to combat social isolation in older adults, the South Carolina Institute of Medicine and Public Health is teaming up with the South Carolina Department of Aging to issue some new recommendations on this. News 19's Sam Perez has more.
I get up in the morning and I sit on my porch while I suck in that morning air and wait for that bus.
Charles Brooks relies on transportation from Senior Resources so he can get to the Cecil Tillis Center to connect with other senior citizens across the community.
It's part of my wellness, and my independence, which I cherish very much.
The South Carolina Institute of Medicine and Public Health, or IMPH, has published recommendations on how to help other seniors like Brooks combat social isolation. They include developing funding models to increase programming, forming a coalition focused on combating social isolation in older adults, collecting more data, helping the elderly become more digitally literate, and increasing access to transportation for senior citizens.
Our state has to be more equipped to handle the volume of older adults that reside here.
Maya Pack with IMPH says the population of older adults throughout South Carolina is increasing as people move here to retire.
The research indicates that being isolated can have the same impact on your overall physical health as smoking 15 cigarettes a day. And when we're talking about what makes our state healthy or unhealthy, social isolation and connection need to become part of that conversation.
This report is going to basically fill in the gaps for what we're looking at in our 5-year plan.
Connie Munn with the South Carolina Department on Aging says this will be helpful to look at state funding to see how it can best serve the older population, who Brooks says is struggling with being alone.
That's torture, really. What do you do when you're in isolation? That's gruesome.
But focusing on how to help is giving him hope. Reporting in Columbia, Sam Perez, News 19 WLTX.
And according to the executive summary from the SC Institute of Medicine and Public Health, nearly 1/4 of community-dwelling Americans over the age of 65 are considered socially isolated. So there are a few ways to combat the potentially damaging effects of isolation. One way is to take regular outdoor breaks. I even do this at WLTX sometimes. It's just nice to get out in the fresh air, look at the sun, go walk your dog, or if it's even as simple as just hanging out on your balcony, hang out on your porch. Being outdoors and letting the outdoors in can help you feel less claustrophobic and more connected to the world around you. You should also continue to celebrate special occasions, celebrate birthdays, anniversaries, and other happy milestones. They're mood boosting and life affirming. Also make time to see your loved ones. While texting and calling are great, seeing face to face is better. If you can't meet in person, Skype, FaceTime, Zoom, those are all great alternatives. And lastly, if you are struggling or you know somebody who is struggling, talk to a mental health professional. There are many supportive services available to help.